Thanks, thanks, Mickey. And you know, I come to you. Well, first of all, Brian a couple of months ago said, you know, Andrew, can you come out to Chicago in March and talk about something that really is simple, straightforward, sort of the easiest aspect of this issue, and that's the politics. And he asked me to do it in 10 minutes or less. So I said, you know, hey, no problem, buy me a glass of wine and I'll be there. So I'm going to talk about three things today, and I'm going to try to move through it quickly so we can do some Q&A. But first I'm going to run through just some of my thoughts around the current healthcare reform debate and the entitlement reform debate, and how that provides some context for advanced care and advanced illness issues. Second, I'm going to talk about some of the opportunities and threats in Washington for advanced care. And then finally, I'm going to spend a couple minutes talking about a new, fairly sizable coalition in Washington called the Coalition to Transform Advanced Care, otherwise known as CTAC. And CTAC is examining sort of new ways, new paths forward on this issue on a variety of topics, from clinical modeling to public engagement and also to policy and political advocacy. So let me just take a minute to talk about, you know, what the conversation and what the dialogue is in Washington. So unless you've been living under a rock, you know that we are talking about the debt and the deficit and the budget in Washington right now. And the numbers basically speak for themselves. In 2001, we had over a $100 billion budget surplus. And just last year, CBO says we had a $1 trillion budget deficit. So, and all economists basically agree that our long-term healthcare cost growth in the entitlement programs, Medicare and Medicaid, is really the end-all be-all for our debt and deficit issues. So I'm going to talk about three quick things that are happening in Washington contextually that I think help us think about advanced care. The first is the political polarization, and the split government is worse than it's ever been. Republicans are running to the right because of primary challenges, and Democrats have actually really moved to the left on the budget issues. So legislating in the middle becomes really, really challenging when we do that. So second, and this is an important point, and it's sort of a nuanced point, is our long-term entitlement reform and cost growth challenges are very real, and CBO and economists confirm that. But in the short term, Medicare and Medicaid are actually growing at a relatively low growth rate, between 3% and 4%. And so when we read in the newspaper that we're talking about cutting the entitlement programs, they're talking about really in the short term. And that's kind of a scary prospect, because there really isn't much more to squeeze out of those programs right now. But what we really need to focus on is the per capita growth rate outside what we call the 10-year budget window. So from 10 years on out. That's where the real cost challenges are. So and my third observation is just that the Affordable Care Act is here to stay. And all of the investment and the cuts in the Affordable Care Act. Let's keep in mind that there's over $700 billion in cuts to Medicare in the Affordable Care Act. And that is the baseline that is now built into the budget. And we had the Affordable Care Act passed by one vote. It was affirmed by the Supreme Court by one vote. And a few million people made sure that Obama was reelected, which basically made very clear that the Affordable Care Act is here to stay. And there's a lot of opportunities, I think, for advanced care in the Affordable Care Act, and I'll talk about that in just a minute. I hope we can have some Q&A on that as well. But let's talk specifically about advanced care. So we have a challenging entitlement reform environment in general, on top of a divided government, and we have a health care law that typically pulls around 50-50 with the American public, and the cuts to entitlement reform programs are even worse, especially among seniors going into a midterm election. But I have to say, the broader entitlement reform discussion does not hold a candle to advanced care, unfortunately. Previously, we saw that the advanced care issue got wrapped up in sort of broader, unrelated, fear-based rhetoric around health reform, big government, rationing, the terms that we all know. And not only that, but the polling at the time confirmed that there was really a pervasive fear of big institutions, not just big government, but Wall Street and corporate America, and basically Republicans and Democrats alike saying, the government is doing nothing to help me right now. Those fears still linger. And what I would say is that for the advanced care issue, it kind of creates a paradox. Because on the one hand, in Washington, we're focused on constraining federal cost growth, yet to the extent that we talk about cost constraint for the advanced illness or the advanced care population, we invite that rationing critique. And so it really creates an incredible challenge, sort of a needle that we need to thread in Washington. And the proof that that we have these sort of that the toxic rhetoric still lingers is that if you look at a recent poll that the Kaiser Family Foundation did, they asked consumers, does the Affordable Care Act allow a government panel to make decisions about end-of-life care for people in Medicare? Unbelievably, 55% said either yes or they didn't know. And of the yes was of the yes, 40%. Of the yes or don't know, yes was 40%. So that's the challenge, and politicians look at those numbers and they have to respect them. So we have a lot of work to do. So those are the headwinds. Let's talk about the sort of the positive aspects of the issue going forward. I think there's encouraging signs. First, the first opportunity I would say is that the political rhetoric really doesn't match the policy reality. This actually is a bipartisan issue. Senator Rockefeller has had legislation for over a decade now that's had Republicans on board. Earl Blumenauer has had legislation around advanced care planning that I just sat in a meeting 2 weeks ago with Charlie Sabatino, who's in the back of the room here, listening to 4 Republicans say, absolutely, we're on board. This is ridiculous. We've allowed this sort of toxic rhetoric and messaging to get wrapped up in an issue that is just way too important. So the first thing I would say is that bipartisanship is very real. And as many of you know, poll after poll has really confirmed that when you talk about what advanced care planning really is, or when you talk about what advanced illness management really is, or hospice or palliation, not only do people want it, they demand it. So we have a lot of work to do on educating people, I would argue. But when we do, they really are supportive, and they're even supportive of having the government ensure that they have access to those services. And so the last encouraging sign I would say is that the stakeholders are incredibly engaged right now, and Mickey touched on that. And I'll talk a little bit about CTAC and their work in just a minute. So what does this mean going forward? Well, I would argue that the current legislative vision is relatively narrow. It really is focused around medical education, research, some resources for public engagement through HHS, but also reimbursement for advanced care planning services in Medicare through typically through the annual Medicare Wellness Exam. It needs to be broader. It really needs to be brought more into this delivery system reform conversation, more into chronic care management, more into care coordination, but for a very targeted population, this immediately pre-hospice sort of gray area advanced illness population. And then I would argue that there's a lot of opportunities well outside of the Affordable Care Act, or in the Affordable Care Act through CMMI, but also through the private sector. I mean, all we have to do is look around this room and look around this conference and look around the country, from Sutter Health in California and their advanced illness management program, to Gunderson Lutheran in Wisconsin, to Ascension, Vanguard, major. We are moving away, as they see that we're moving away from fee-for-service and into this new shared savings, shared risk proposition. The new world order is to take better care and provide higher quality care for this very specific and very vulnerable population. And so we're seeing a lot of amazing innovation in the private sector, and I would argue that we need to, that doesn't even need a legislative fix. We should just be, looking for more opportunities for the private sector to innovate. Zeke Emanuel says that we should use the Joint Commission to put standards on hospitals to have, palliative care accreditation programs. So that's just an example. So we have an uphill battle, but there really are opportunities for advanced care. So what do we do next? Again, focus on bipartisanship. And what we've found, which is amazing in conversations with members on the Hill, is that if you just start with personal stories, if you just start with, hey, let's have a conversation about grandma and grandpa, or your mom and dad, or your brother and sister, it automatically neutralizes any political issues and normalizes, and I love this word, normalizes the conversation, because we all go through it. And that takes it just away from anything policy, anything political, and anything toxic. And so we've had a lot of success doing that, and I think we need to do more of it, and Compassionate Choices and many other groups, the Conversation Project, are really doing a lot of incredible work to allow us to do that. But we still have to be careful with language, and we have to be careful about how we determine what works and how we execute it. And then, there's some disagreement about this, but I would argue that we need to also underscore that the status quo in this area and for this population right now is just not acceptable. And that actually is a policy choice. If we do nothing, that is a policy choice that has serious consequences for this population. So specific action steps going forward that we talk a lot about in Washington that I would argue are that we have to build out a policy that is airtight, that can be validated by the think tank community, and that is scorable by the Congressional Budget Office. Hopefully 0. I don't want it to cost anything, and it shouldn't save too much money. If it does, we're going to have to, our messaging challenge is going to be much greater. Number 2, we have to develop a winning message that supports this policy, that's grounded in, as Lynn was saying, truly in person and family-centered care. Thirdly, I would say, as important as the message, and people don't talk about this, as important as the message is the messengers. So whether it's nurse, doctor, ARP, family, caregiver, faith-based leader, we really need to focus on the messengers as much as we focus on the message. And last, and I think most importantly, it sounds simple, but we really have to work together. We have to break down the silos, and we have to normalize the conversation and work together. And so let me just take 1 minute and talk about the Coalition to Transform Advanced Care. So the coalition, I'm just going to read their vision to you. CTAC's vision is that all Americans with advanced illness, especially the sickest and most vulnerable, will receive comprehensive, high-quality care that is consistent with their goals and values and honors their dignity. So who is CTAC? CTAC's over 100 organizations, almost all of which you'll know, and it ranges from health plan like Aetna and United, Kaiser Permanente, to business, to consumer. AARP is an incredible member, caregiver, faith-based, academic institution. It really is an incredibly broad-based group of stakeholders. And so the question is, what are they doing? Well, they've organized into 4 work groups. The first is the Public Engagement Work Group, which is focused on developing a national public engagement campaign, again, to normalize the conversation and talk about what's working in the private sector. Number 2 is to develop and promote the implementation of a new best practice-based care model for this very specific advanced illness population. So they've brought together clinicians from all over the country, chief medical officers, ethicists, and others, again, many of which you'd know, to really look at, okay, what are we doing that works and what are other folks doing that works, and let's develop a best practice-based model. Number 3 is to promote education and training and support for healthcare professionals, looking at medical education. And number 4, and it's intentionally last, is focusing on policy and advocacy. The policy and advocacy work group is really looking at learning from the clinical models work group and the professional education work group in order to see, if anything at all, what, if anything, needs to be changed in current law in order to provide higher quality care for those with advanced illness. So I would just say in conclusion that we have this incredibly political and challenging healthcare entitlement reform and budget conversation happening in Washington, but I really think that there are opportunities, incredible opportunities for this issue, whether it's the private sector innovation or the bipartisanship that we're seeing on the Hill and well beyond in the states as well. The more rational dialogue that's beginning to build in Washington and in communities all over the country. But we really have, I think we have a real opportunity here to have an incredible impact. But it's really if and only if we can break down our silos of care and have a real rational dialogue about how to provide higher quality care for this population. So I'll end there. Thank you very much.